Greetings, my name is Dr. Doug Cluff, and I am excited to give you a little bit of an introduction to my new practice, TLC Family Health, and to myself. I am sitting in the comfort of my office at 2601 Church Hill Drive, Suite 100 in Flower Mound, Texas. I am a family physician and have been actively practicing since 2001. First started after residency in a small family medicine practice in North Irving, Texas. And then in October of 2017, I founded TLC Family Health after many years of designing and pondering. And in a nutshell, it is an affordable membership model of primary care, otherwise known as direct primary care, where I have a direct relationship with you and nobody gets in the way. We boot insurance completely out of the equation. There are no other middlemen, no incentives to mark up prices. This type of practice is ideal for the self or uninsured, but most of our patients have insurance. It's just that they have high deductibles that usually far exceed our yearly membership fee, so it actually saves them money. Like all family physicians, I try to manage over 85 to 90% of all of your health care needs for a fraction of the usual cost. If you could design your own practice, how would it look? For me, that would include online scheduling, video and telephone visit options, a personable caring physician, open communication with the doctor via the patient portal, little to no wait times, in-office testing and labs and treatments at cost. And as an aside, I cannot emphasize how crucial it is to understand that point. When I get rid of all middlemen and contract directly with labs, directly with suppliers, and then pass those savings on to you, essentially we'll drop prices by over 90 to 95% for those types of things. The ideal practice would also include transparent pricing, emergency cell phone access, discounted mental health and nutrition counseling services, and procedures at no added cost, and more. My practice is a little bit different than most direct primary care practices. I actually have 3 plans: Silver, Gold, and Platinum. The Silver plan provides a 50% discount off visit fees with an average price for adults of $27 per month. That is the plan that people who don't feel like they need to access my services much, probably fewer than 2 or 3 times per year, would benefit most from that plan. The Gold plan is my best value, which provides a 90% discount at an average adult price of $50 per month. And those who want to have unlimited access and receive 100% discount off of all services, including visits and communications and things, have an average adult price of $75 per month. So more about me: I trained at the Texas Tech University Health Sciences Center School of Medicine in Lubbock, Texas, and did my residency at the University of Texas Medical Branch in Conroe. I moved with my young family of 2 to Flower Mound in 2001 after finishing residency, and I made sure I was outside of the 7-mile non-compete from my practice, because I knew one day I would want to start my own practice close to home. I have significant interests, and some would say even some expertise, in nutrition and weight loss. Excuse me, but I also have interests in thyroid disorders, sports injuries, preventive medicine, women's health, dermatology, and minor office procedures, which again are provided at no extra cost. One thing that you probably need to know about me is that from my mid-20s I struggled with my weight and gained about 45 pounds or more, a few more than that, between my mid-20s and mid-30s. Since then, I've lost probably around 35 of those. Some would say, well, you obviously haven't found the answer because you haven't lost all of them. Welcome to life. Most of my patients appreciate the experience that I have and the continued efforts that I have to make. I am down to a normal weight, although like many, I'm trying to get rid of some of those last pounds. When I was in my mid-20s, I was probably too skinny in some people's estimation. Anyway, in 2003, I self-published a little book called Svelte Self, svelte meaning slender. And in 2006, I published a large 380-page monster called Svelte Life, The New Weight Loss Reality. Do not buy that book. You can find it on Amazon, but a lot of it is obsolete now. I'll explain that in a little bit. In the 2000s, for 3 years, I held a weekly weight loss support group called Svelte Shops. And then in 2014, I developed my current Slim TLC program. I also co-founded with friend and pediatrician Michelle Fowers a program for kids called Svelte Kids. Later changed that for a few reasons to Kid TLC. And then not only have I had my own personal experience, but I've applied that experience and other knowledge that I've gained to many patients, probably thousands. In 2011, I became aware of a new science of nutrition. I'll touch upon the outcome of that in the last slide, but that made the nutrition chapter in my Svelte Life book mostly obsolete, even though much of it still applies. From 2012 to 2015, I served on the board of Keep Flower Mound Beautiful. Unfortunately, had to recuse myself from that board just because of how busy I became trying to prepare for my current efforts. May someday go back and try to help them out again. And for 2 of those years, I served as chairman of its Keep Flower Mound Healthy subcommittee, which I founded. In 2016, I founded a nonprofit organization called Project 20Teen with the goal of making it easier to be healthy. And likely we'll be changing the name to Project Simplify Health because we are getting close to the end of the 20 teens, and the initial prime directive is to help restaurants to offer healthier fare. Speaking of which, it is hard to get restaurants to offer healthier fare, so I'm almost going to guarantee that within the next several months I will be opening up my own restaurant, jumping into the fray, hopefully helping to provide patients, public, with a worry-free trip to the restaurant. And the restaurant will be called Holy Kaboli. It's an interesting story of how that name came about. I'm also working on my next book called How Not to Get Sick, and at my current pace should be available in somewhere in the year 2049 or so. I enjoy sports, writing, playing piano, singing, even though I wish I could sing better. Watching movies, I do that pretty well, and spending time with my wife and 6 children, ages 11 to 23 at the time of this recording. I also have a son-in-law, and a great blessing to our lives, a granddaughter, Brinley, born in June of 2018. And for my final slide, I wanted to share a little bit about my nutrition advice. I have developed something that I call the Nutrition Star. It contains 5 sections: vegetables, fruits, whole grains, and high-quality protein/good fats. The 5th section, the whatever section, includes all things that I consider either addicting or less healthy. My nutrition advice can actually be summarized, because I do not believe you need to obsess about getting 20% of each section in the star, by the 4-to-1 rule, which states eat at least 4 healthily prepared plant and or fatty seafood based foods for every whatever. In my experience in research, reading, I have learned that by following this rule, you could probably prevent the grand majority of disease. And those who already have disease might actually have to go higher than 80%, but this is a wonderful place to start. The average American, however, lives at less than 1 to 4. And for those people, I recommend trying to approach nutrition from a bottom-up approach and start at least at 1-to-1 and move up from there. For those who are sick and tired of fighting the fight and or who have disease that they're trying to reverse, I recommend going top down, and that is where you go all in, hit the ground running on all cylinders, cut out all whatever foods, eat 100% healthy, and try to do that for 2 to 3 weeks, and it will help break addictions. It will help break bad habits. And once you are successful at doing that, you try to settle back into the 4-to-1 ratio. Anyway, there is a lot more to that. I have hours that I could spend talking to you about other aspects of nutrition and health and lifestyle changes. We will have to save that for another presentation, but I hope this provides a nice little summary of who I am and what my practice is all about, and I hope you come join us and see what kind of magic we can conjure up for you.